Good evening, everybody. So today's topic is Meibomitis. Now, definition of Meibomitis is inflammation of the Meibomian glands. Before talking about Meibomitis, we should know exactly where the Meibomian glands are situated. Here you can see surface anatomy, upper lid and lower lid. Here, just under the skin, there's a orbicularis oculi muscle, and just behind that, there is a Meibomian glands in the tarsal plate. Lower and upper. Upper Meibomian glands are more than the lower. But if you take the sagittal section like this of the lid, you will know that outer is a skin. Then comes your orbicularis muscle. Then comes your Meibomian glands, which are in the tarsal plate. So here, these are the muscles, orbital muscles. This is a levator muscle. And just behind the orbicularis and the levator, there is a Meibomian glands. This is a Meibomian glands. This is in the tarsal plate. And just underlining the Meibomian glands is a conjunctiva. So if you invert the lid, sometimes you can see if it is inflamed, you will see the Meibomian glands, like that, parallel to each other like that in the lids when you invert the lid. So this is regarding your Meibomian glands, where this is situated, and the Meibomitis. Now, before talking about the Meibomian glands, the Meibomian gland secretes the lipid secretion. It's little oily. And that is a part of your tear film. So here, if you see this, for example, this, if you see this is a cornea, and then this is a whole is a tear film from here to here. And the innermost is a mucin layer. So the mucin cells which are there, which are in the conjunctiva, and they secrete the mucin. So just above the cornea, there is a mucin layer. Then comes the aqueous, which is secreted from the lacrimal gland. And here is a lipid layer, which is secreted from the Meibomian glands. So whenever the Meibomian gland secretion is reduced, naturally the tear film, which is their aqueous layer, reduces because of the evaporation. And there is a symptoms of dryness. If you talk about the symptoms of dryness, usually there is a foreign body sensation, there's a itching, there's a watering, there's a burning sensation. So these are all the symptoms of dryness. So whenever the patient comes with the symptoms of dryness, we should first rule out Meibomitis before talking about any other layer. So when you see and examine the patient, you will see that in your lid margin is there. These are all opening of the Meibomian glands. That means just first is the outer side is the eyelashes. Just behind that, there's the opening of the Meibomian glands. Here you can see. These are all blocked. See, these are blocked because of some dust particles getting blocked. Or sometimes the patient goes on touching the eye, and because of that, there's an infection and that's a blockage. And because of that, whatever secretion is there in the Meibomian glands, they are all secreted and they are inside the only, it doesn't come out. So this you can see by examination, especially on the slit lamp, you will have idea. And the patient also has got a discharge, lots of oily part is there outside. So, and when you see, sometimes you can see the capped Meibomian gland, that means there's a capping. Here we will see like that elevation. And the discharge which is there, usually it is a foamy discharge. You will see here, foamy secretion like that. It's a very important sign for Meibomitis. And there is a redness, there's infection. And there's a fluctuation of the vision because of the secretion which comes in front of the cornea. That's a vision reduced. So this is regarding Meibomitis. And especially in case of Meibomitis, how do you manage? Very important is in all the apathies, we have to do for warm compresses. Why? Because with the warm compresses, the secretion which is thicker, that can become little liquidic. So this you can do. And then after that, you can do massage. So whatever secretion is there can come out through the opening of the Meibomian glands. And antibiotics. Sometimes the steroids are given. Oral antibiotics also depends upon the severity of the Meibomitis. And cleanliness is equally important, not to touch the eyes. All this is very important. Wearing goggles when you go out so that dust particles will not go in the eyes. These are the things we have to take care. And you can try and take other therapy also uh, along with allopathy, or if everything is fine, you can continue other pathies like homeopathy, naturopathy.
Okay, unable to start the video because host has stopped. Unable to start the video because host has stopped it. Okay, now I can. Now I can. All right. So I think Dr. Pushpa has already discussed about I think the Meibomian glands and Meibomitis. That's what the topic is for today. And I think it would be a good idea to talk about some important homeopathic approach and homeopathic remedies in it. And definitely, the first target as a homeopathic physician is to find the remedy for the patient. That would be the first target, to individualize, to take the case, and then prescribe the remedy based on the deeper patterns. However, there are certain homeopathic remedies which have a specific action on the meibomian glands, and few of the remedies are in the initial stage. A remedy like Hiparsulf in a very, very chilly individual. Euphrasia, is the biggest eye remedy. Pulsatilla, especially with the yellow discharges that and a very sensitive personality. Phosphorus, with a person with a very deep tubercular miasm. And of course, sulfur. In a suppurative state of meibomian gland, phosphorus and conime are important remedy along with Hiparsulf. But when there is more swelling, there is a glandular pathology. Typically, that is when you think about remedies like Bardiaga, digitalis, Phytolacca, Staphysagra. And with tumors that are developed in mammalian glands, the remedy of choice often is Staphylococcus aureus, and a lesser known remedy is Lolium temulentum. A very important remedy is colchicum, because these people who require colchicum are very, very sensitive. And somewhere in their life, slightest misdeeds of others have affected them. So most remedies with meibomian glands pathology have a deep psychosomatic effect. And somewhere the mind state has affected the body, and then the disease pattern has developed. So these are some interesting things to know. Of course, the idea is to individualize the case and find the remedy for the person. So we have this integrated homeopathic clinic for ophthalmic diseases specifically, and all other cases here in Mumbai. Make the best benefit of this. Write to us. You can either come and meet us in person in Mumbai, or we can have an online consultation. The best way to contact us is by email, that is gaurang@gmail.com, or you can also WhatsApp on the given number. Thank you and namaste.